Ladies and gentlemen, we will now like to begin the presidential lecture. This lecture will be presented by Professor Toshio Oshiro. Introducing him will be Chairperson Professor Harubumi Kato.
Good morning, ladies and gentlemen. I am very much honored to be able to chair the presidential lecture by Professor Toshio Oshiro, the 18th Congress of International Society for Laser Medicine and Surgery. First of all, I would like to express my sincere congratulations and appreciation to Professor Oshiro for holding this wonderful international Congress. Before President Oshiro's lecture, I would like to introduce his splendid curriculum vitae briefly. Professor Oshiro was graduated from Keio University School of Medicine in 1942, and he trained plastic and reconstructive surgery in Keio University and studied under the Professor Leon Goldman in Cincinnati University. He's now visiting professor of Keio University, President of Japanese Society for Laser Reproduction, Secretary General of World Federation of Societies for Laser Medicine and Surgery, and important executives of other societies. His academic activities are so great. He would have written more than 300 papers, scientific papers so far, and played so important roles in our Japan Society of Laser Surgery and Medicine. He extraordinarily contributed to the progress of laser medicine, not in our country but internationally. I'm sorry not to be able to introduce his activity all. Therefore, I would like to introduce his activity now. So, I would like to ask Professor Oshiro to start his lecture, please.
Thank you very much, Professor Kato. Ladies and gentlemen, distinguished guests, it's my very honor and pleasure to give a presidential lecture in front of you. Today's theme of my own is Oshiro's new classification of laser treatment. I had experience of 35 years experience of laser field, laser surgery and medicine. And so from this kind of experience, I would like to make my new classification of laser treatment. I treated 71,000 cases from June of 1975 to May of this year. And these the dermatology and plastic surgeries, one is nearly 56,000, and the polynosis cases, 6,000 cases, and female infertility cases, 830, and pain clinic cases, 8,000. Next slide, please. And, okay, sorry. These are the main the work of myself is the dermatology and plastic surgery. And these are my main treatment cases. The nevus cell nevus, hemangioma, dermal melanosis, and nevus pilus, scarceloids, and denile flake and chloasmer, and so on. And so I made a lecture all over the world, these cities. And these are the cities in USA. In case of consider about the photobiological action and reaction, we have so many action and reaction. In it, the photothermal reaction is the main reaction. So I would rather classify my classification from the point of the photothermal reaction. This is the first case of treatment treated by argon laser patient. This patient was already treated by electrocoagulation 2 months ago. But this is not treated by hemangioma simplex by argon laser. But 1 month later, we get this condition. You can see here the lasted area. It means the hypertrophic condition for the treatment of electrocoagulation. But when we give the thermal reaction of argon laser, but it can stop hypertrophicness. So I thought the laser effect can have a thermal effect plus alpha effect. In this patient cases, I treated this patient 30 joules per square centimeter of UV laser, and also the argon laser cases. In this case, is 15 joules per square centimeter, but they compare the UV laser and the argon laser space, and in the same area, but the reaction is totally different. Hyperpigmentation is more than argon laser is higher, and hypertrophicness can give more compared to the UV laser. So we want to use hyperpigmentation reaction to treat the vitiligo treatment. And then we tested this small area 4 months ago, and this area treated 3 weeks ago. And then we can get the reaction. This is the 4 months post treatment, laser treatment, and these are the 3 weeks. And then you can see here the surrounding area, donut-like, O-ring-like hyperpigmentation we can get these areas. And so in the center is the heat spot area, and so somehow the peripheral zone we can give a hyperpigmentation. In this patient cases, we also use the argon laser, and in this patient cases, we can remove redness of hemangioma simplex, and in the same time, we can remove the post-herpetic intercostal neuralgia in the same time. So I considered the argon laser attack to the skin surface, and then it spread into the deeper area and peripheral zone area. And then the high intensity can remove the redness of hemangioma, and the low intensity of the argon laser beam may be attacked to the intercostal nerve. We saw it. And then this is the experiment of, we cut the protein scan with CO2 laser. And then we can get these kind of histological result. And so we thought the E and F area, vaporization and carbonization might be occurred. And C area, protein breaking, and D area is protein coagulation, we thought. And might be the surrounding area, might be the photo activative reaction might be occur. We thought. And we gave the helium neon laser at the lateral side of the acrylate plate, and then we can get this kind of scattering pattern. And so the center might be the heat spot, we call this. And so in the center we can give a carbonization and the peripheral zone deeper, and we can give vaporization, protein coagulation, and protein breaking. And some kind of welding reaction might be occur, and the most peripheral zone is the activation zone. And so the poor zone of this, we can give a death to the tissues or cells. And we can give this kind of reaction. These are alive condition. And so we make these kind of schematics. Carbonization zone, vaporization, protein coagulation, and protein breaking, and welding, and photoactivation. And so, if we give a very low intensity the laser to tissues, we can give laser activation. We named this one, laser activation, photoactivation. So the activation laser treatment. We can give this kind of laser upper-like scattering pattern. So I call this is a AC apple. And the intensity giving a higher, we can get the welding apple. We can give a photo-breaking apple and photocoagulation apple, photovaporization apple, photocarbonization apple, CA apple. And so we can get 6 types of treatment methodology using one laser. And so I named the laser consideration about the laser apple cases: AC apple, WE apple, and PB apple, PC apple, VA apple, and CA apple. It's respectively AC laser treatment, WE laser treatment, and PB laser treatment, and PCLT, VALT, and CALT respectively. And these are the biological reaction. Consider compared to these materials, this pure activation apple cases, pure laser treatment, in other words, we can give the LLT, low reactive level laser therapy. This is non-surgical treatment. We can use AC apple. When we use the W apple, we can give MLLT welding plus LLT reaction in the same time. So the auto-simultaneous reaction, 2 reactions using one laser we can get. So the auto-simultaneous AC-LT, I name it, naming to this one.